Today's story is sponsored by Tidelands Health.
Good morning. Thanks for watching Living Local. I'm here at Tidelands Health Breast Center, and I'm chatting with Dr. Craig Brackett. How are you?
Good morning. How are you?
I'm doing well. So we chatted with you last week. So we're back today to kind of go over all of the frequently asked questions, right? All of the misconceptions, all of the, who, what, when, where of breast cancer, because it's October, which is Breast Cancer Awareness Month. So, I'll start with, how often and who should be getting these mammograms?
So there's been a lot of controversy about mammography in the last few years. And I think really what the American College of Radiology and some of the bigger societies really believe in after all this debate was that a mammogram should start at age 40, and it should be every year, and there's no age limit to mammography.
Okay.
So that's our recommendations to our patients here.
Okay.
So if you have a family history, you go 10 years before the person in your family had breast cancer.
Oh.
Certainly if you have, in the 20s, it's hard to do mammography because the breasts are so dense, it's very difficult to see inside the breast. Of course, with the 3D technology we have here, it's a little bit more helpful. But if you're feeling something in the breast, generally what we do is an ultrasound.
Okay.
Is our initial approach to that.
Well, I know when I was kind of learning about breast cancer back in the day, it was kind of like feel for something that's like a hard pebble type thing. Is that the case, or it can feel like all sorts of other things?
It can generally feel like all sorts of other things. The benign things kind of roll around like fibroadenomas. They're kind of freely mobile. They're very smooth. Cysts are kind of the same way. Tumors generally don't move a whole lot because they're fixated to the surrounding tissue, and they have an irregular contour to them.
Okay.
And I think that's a really good question because, there was a study that said we shouldn't be doing clinical breast exams and women shouldn't be doing self-breast exams. But, we're still seeing 35 to 40% of the cancers we treat in this facility are palpable, meaning you can feel them. So I still think there's some important role to doing breast self-examinations and for clinicians to check a woman's breast. Once you start your mammograms, you get them every year.
Wow. The great
Mammograms reduce the risk of dying. It used to be 25%, but now that we have 3D here, the tomosynthesis unit that we use, which is like a CT scan of the breast, we were actually third in the state to do that. So there's no question that screening mammography saves lives.
Sure. So, Dr. Brackett, what can a patient kind of look for when they're coming in to see you?
Well, I think, a lot of times because we are so dogmatic in our screening, we find things that you may not see or feel. But still today, we still see, you might develop a swelling in the breast, or the skin will look like an orange peel and have some erythema or redness. Those are warning signs, significant warning signs. You may have a dimple when you raise your hand up and you see a dimple where the tumor is pulling on a ligament and causes dimpling of the skin. Wow. You may have bloody nipple discharge. There's one tumor that actually will shrink your breast. And then anything you feel, anytime you feel, a lot of times, like we said earlier, 40% of cancers we diagnose here are palpable, meaning the patient can feel them and I can feel them, or my partner can.
Well, and then let's talk about some risk factors for getting breast cancer.
So, the biggest risk factor really is age. 50% of breast cancers occur after 65. If you have very dense breasts, there's a 4 to 6-fold increased risk of breast cancer compared to a woman who has a fatty replaced breast. If you've had a history of an atypical biopsy, so we do biopsies with some of the calcification we talk about, and you can see an atypical proliferation, and we know that's a lesion that could become a cancer down the road. And you put that and combined with a family history, that's actually a 10 to 11-fold increase.
Wow. And how about risk reduction?
So, and my nurses laugh at me because it's like a broken record for every patient. Are you taking your vitamin D3? Are you taking your omega-3s? Have you gotten your BMI below 30 and actually really want 26? And that's really hard with COVID because everybody put on the COVID-19. and then the sugar, flour, bread, starches, high fructose corn syrup, processed food. The funny thing we say is Cheetos and Fritos are finger looking good, but there's nothing good in them.
Well, all good information. I appreciate you taking time to sit down and chat with us today. Well, folks, if you'd like to learn more, just visit the information on your screen, and you can always go visit tidelandshealth.org. Thank you so much, Dr. Brackett, again for chatting with us. Thank you guys for watching Living Local. We'll be right back.
Today's story is sponsored by Tidelands Health.